Are in front of the top teeth.
Okay.
That's Dr. Engel. He named all this stuff a long time ago.
Okay.
We still use it.
Oh.
So you're in the adult dentition. You have just a few teeth missing. These are the teeth that are missing.
Okay.
You're supposed to have 32 total. All of your wisdom teeth are gone, plus a bunch here in the front,
Okay.
and a couple up here too. But we'll make this work.
Mhm.
You have two teeth that are transposed. So that tooth is supposed to be on the other side of this one.
Okay.
Okay.
So I talked to Dr. Savelli just a little while ago. She'll get this one out of the way. This is the stronger tooth. We'll put it right there.
Okay.
Okay.
All right, so you don't have to have two rows of teeth.
Okay.
We don't want people
Okay.
thinking you're a shark.
Yeah, I knew that.
All right, so you have some crowding of your upper teeth, just the overlapping here. We'll get that fixed by taking one of the teeth out of the way. You have an anterior open bite, and that simply means that when your teeth are biting together here, they don't come together vertically. So most people, when you look at their front teeth, you can't see between them when they're biting. Your teeth are open like that. And that's not the teeth being out of line, that's the bones being out of line. And that's one of the things they're going to change when they move the bone.
Okay.
Okay.
So that's that. You have the underbite, we already know about that. Your upper front teeth are behind your upper face. We would expect that to be the case. By the time we're all done, we want your upper front teeth back here to be even with the front part of your face here. Right now, they're back a ways. Your front of your lip is actually kind of even with the front of your face. It's just one of the things that we look at to say, is it really that this one's too far forward, or is this one too far back? And it's that the upper one is too far back.
Okay.
That's expected because of all the scars of on your upper jaw from your earlier surgeries. The other thing is that this jaw is very V-shaped. It's very flat on the sides. This one is round. They don't match.
Yeah.
So our job with the braces is to make this one more rounded. That's the more ideal shape.
Okay.
So when they fit, that's when we have your jaw moved. Now, the edges of your front teeth could use a little reshaping. They have all these little bumps on here. They've been that way since you were 6 years old. And most people, they wear down fairly smooth. We're happy to smooth them down for you if you'd like, somewhere along the way.
Okay.
Now, the plan is to have one tooth removed, so we can
Okay.
put that one there. We're going to put braces on all of your teeth and put them in a straight line. Then we're going to start having scans done. We take the photographic scans and we print models like this, and then we do instant hand surgery. Let's see, does that fit? Not yet. So what do we need to do next? What
Okay.
has to move? That sort of thing.
Okay.
Every few visits, we'll take a set of these models. We know what to do next.
Okay.
Because unfortunately, you can't put your teeth together for me,
Right.
so I can't see how your bite looks.
Right. Right.
And that's not something that we can change with the braces. That's why you have to have the surgery. As soon as we get two scans that fit together properly, then we have some new x-rays done and you have your surgery to correct the bite. When you wake up from the surgery, you'll be wearing rubber bands. Those are elastics. The elastics will be there for probably 1 to 2 months, and then they will return you back to our care to do any little last details with the braces. You're going to have some replacement teeth put here. So do you have a dentist that you work with other than Dr. Savelli, or
No.
just Dr.
I
Savelli?
think it's just doctor. Yeah.
Okay, so here's the problem. Pediatric dentists don't do prosthetic work,
Okay.
implants and crowns and stuff like that.
Okay.
So do you have a dentist that
Yeah.
you see?
Mhm.
Are you real comfortable with them? You
Yeah.
like them?
Mhm.
Good.
So change him.
You don't have to change them, but at least introduce them to your dentist
Okay.
so that you can start talking to them about, we need to do some replacement teeth here.
Okay.
What are our options?
Okay.
Start getting information.
Okay.
And I have to warn you, it's expensive.
Okay.
It's probably $3,000 to $4,000 per tooth.
Okay. Okay. All right.
Now, so once we get the surgery done, you'll come back to us with some little detail stuff to get ready. If the dentist has some particular requirements, they want a tooth moved a little bit one way or another to get ready for the bridge or the implant or whatever you're having done, we can do that for the dentist. As soon as we get clearance from the dentist, then we can take your braces off and make retainers for you. Now, I estimated this is going to take 2.5 years. I don't know that it's going to take that long particularly, But the braces themselves will take us about a year and a half to 2 years. Plus we have to add in the time it takes for you to see the surgeon and get the surgery scheduled and all that. And sometimes the surgery scheduling goes really quick, like a couple of months. Sometimes it takes 4 or 5 months. So there's a lot of variables
Right.
in the surgery scheduling that I have no control over. That's why I put in 30 months.
Okay.
Hopefully we'll all be done by then.
And then who's the surgeon that does it? Would it be?
You with children's?
Yeah.
It'll be
Dr.
there are 3 surgeons.
I think it's a
Dr.
Gosman.
Massenberg.
Oh.
They're right here. Dr. Jeju, Dr. Kanak, and Dr. Massenberg.
Oh, okay.
Dr. Gosman is
Uh-huh.
also there, but she's not doing much of the jaw surgeries anymore. She's doing
Oh.
other types of
Oh,
surgery
okay,
now. She's
okay.
the department chair.
Oh,
She gets to
okay.
pick what she does.
Okay. Okay. I see.
Anyway, it'll probably be either Kanak or Massenberg.
Okay. Okay.
And we'll get that organized when it gets closer to the time of
Yeah.
doing
So the
it.
surgery isn't any
It's-
time. Not
At the
not right
very
now.
earliest, the surgery will be, this is October, maybe towards the end of next summer.
Oh, okay.
to early
Perfect.
fall.
Yeah.
Yeah.
Because he's a senior. We were kind of like.
Yeah, we
yeah.
usually try to plan the surgery for the summer after graduation. We
Yes,
don't always
perfect.
quite make it during that summer,
Okay,
depending on
that's fine.
scheduling. The surgeons will be, if you want to have a surgery in summer, you have to schedule by maybe January, February
Yeah.
to make sure you get in,
Okay.
because summers get real busy.
Right. Right. Yeah. We weren't. He was. We're
What's
gonna
the
have him.
what's the plan for after graduation?
After graduation, we wanted to take him a year off of school just so that he can
Do all this
do
stuff.
all this stuff
Okay,
before he
because
goes back.
the jaw surgery is the first of 2. The second surgery is usually a final touch-up on the lip and
Right.
nose. So that, and they have to be 6 months apart from each other.
Okay.
So that's most of a year by the time you get done with it.
Okay. All right.
Good plan, Mom.
Okay.
You're planning ahead. Anyway, so that it's just a note here that our estimate on time does not include pre-surgery scheduling and all that. That's very highly variable.
Okay.
Once you get your retainers, you'll wear them all the time for a year. You're getting rid of this one on the bottom, by the way. It goes away. After a year, you wear them every night until you're 23. That's kind of a long ways away yet.
Yeah.
Anyway, questions about any of this?
No. So is today you're gonna put something or
We're going to put spacers in so we
okay.
can get started on his braces, yes.
Okay.
So
So no braces today, just spacers or.
we have to put, the surgeons require
Uh-huh.
that we use these ring-type braces
Okay.
on the back teeth.
Okay.
And right now, his back teeth are all very tight together. We couldn't
Right.
fit anything in there if we wanted to.
Okay.
Try to put a ring on, we'd have to use a hammer. And
Okay.
You don't want me to do that.
Right. Definitely.
So we're going to
Yeah.
make space, and that takes a week
Okay.
or so, and then next week we'll start fitting all the braces.
Okay. All right.
So yes, you're starting today, but he's not going to leave with any braces on his teeth.
Okay.
Just spacers.
Okay.
All right. Do you already have another appointment scheduled or not yet?
Not yet.
Okay.
Yeah.
And then the appointment with Dr. Savelli can be
Mm-hmm.
as quickly as you can get in there to do it.
Okay.
She said she'll take that tooth out for you.
Okay.
All right. Is there anybody in the room that claims to be 18 or older?
Me.
She admits it. Do I need to check her ID?
Mhm.
I should. Oh, that's a good answer. I like that answer. All right, Mom. Would you be kind enough to sign right here? Since we went through this together, I'll get a copy for you. Is one copy enough?
Yeah.
So,
Now, since you have such a beautiful signature, would you please type your name on the keyboard? Thank you. I'm sorry, do you have a question, Matt?
so the delay teeth, are those supposed to look like my teeth?
Which teeth? These
Oh,
over
those,
here?
those teeth.
Those? No,
Yeah.
those aren't yours. No,
Okay, good.
no, they're not yours.
Okay,
Yours look quite a bit different than that.
okay.
Alrighty, that's done. Da da da, like magic. Let's print this. Da 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 da. Go over to the printer. The electrons have to run all the way from here to Sacramento and back again. There they go, they're running. Okay. Okay, we have one more document to go through, Matt. This one's for you.
Mm-hmm.
Your mom will be interested in hearing it, but mostly next one is for you. Talks about some of the jobs you're going to have when you wear the braces. So the first thing is hygiene, and that's the most important, actually. when you have braces on your teeth, they're the little square things here. They're just glued to your tooth. That's just a handle. That's how we hold on to your tooth to move it. This wire that goes across, that's what actually pushes down the teeth. Push them in a straight line, and then we can slide them along the wire and do stuff like that. When you eat, food's going to get stuck sometimes wherever this wire goes across in these spots. So make sure that you smile carefully and then brush out any food in there before you go smiling at your friends. So you don't want to smile to them and have a big chunk of lunch stuck right there, right? You look like a dork. Don't do that. Now, the other thing I need you to do is to be sure to brush the area between the brace and the gums. Lots of debris and food stuff gets stuck in there, and it causes trouble. So what I want you to do is actually brush your gums, just like this. Point your brush at your gums, little circles, do it gently. Every single time you brush, go through and do that, and then you'll keep your gums nice and healthy. Come over here. See how shiny and smooth that tooth is right there? See how it's all bumpy right above that?
Yeah.
It's all bumpy up here, and it's all smooth down here.
Yeah.
Yeah, so when you're brushing, you brush right up to here, and then you stop, and then you go over to here, and then you go over to here. You don't ever do this part.
It's her. It's her. She does the
me.
blushing. It's
I
her
do the
fault.
brushing, Doc.
Yeah, it's her fault, not
But
me.
you know what? I'm
No
wondering.
passing the buck. They're your teeth, not hers. What are you going to do when she's on vacation and she can't brush for you?
You're not going on vacation.
Excuse me? You're already telling her that she's not allowed to take a vacation?
No.
Anyway, you need to clean that stuff off
Okay.
of there. If you leave that stuff on there a lot, over time, it starts making scars on your teeth that look like that. The scars make the teeth very weak. They get cavities, all the places these scars show up. So we want to make sure, and you can see it's mostly right along the gums here and along the gums here. Those are the areas that need extra attention. Every time you come, we're going to be checking, let you know any areas that we see that need extra assistance. See how this is all dull back here and it's all shiny over
Yeah.
here? That's plaque. That's the same stuff as you have up here.
Ah.
So all of the metal in the back,
Yeah.
if it's not shiny, it's not clean. It
Okay.
doesn't rust.
Okay.
Okay?
Okay.
Alrighty. So the dentist. If you're going to continue seeing Dr. Sabelli, that's great. If you're going to see Mom's dentist from now on for cleanings, that's also fine. Whoever you're going to see, check and see if they want the wire that goes across taken out for the cleaning the next time he's due for a cleaning.
Okay.
All right. Dr. Sabelli generally does not, but your dentist may.
Okay.
Now, root resorption. When you were a little kid, all your teeth had these bumps on them,
Yeah.
like that.
Yeah.
These guys have gotten kind of smooth. They don't have
Yeah.
the bumps anymore. Just like the tops of your teeth wear down over time, so do the roots. They actually go from being pointy to round. Yours are all rounded off already.
Okay.
And when they rounded off, they got just a little bit shorter, and that's
Yeah.
normal wear and tear. They started kind of pointy like this one. You can see this one's up a little shorter now. We've had a few people show up with teeth that never grew a root like that. And so that's why we take these x-rays. Your teeth are nice and strong. They're doing fine. Now, TMJ is the jaw joint, the one right here by your ear.
Yeah.
It can click and pop just like people do with their knuckles. All joints make little noises once in a while.
Yeah,
Not worried about that. They can also get seriously injured if you have an accident. If they start hurting all the time, the best person to fix them is a physical therapist.
Okay.
Just like
Okay.
if you hurt your knee or your shoulder, same thing.
Okay.
The braces have no ability to fix joints that get into trouble, and they don't make trouble for joints.
Okay.
Now, treatment time. We will move the teeth as fast as this body allows us. If this project is taking too long and going too slow, please have a talk with this person right here. Do not whine or complain to this person. Got it?
Okay. Yeah.
Be nice to mommy. Now, TMJ we did, treatment time. Limitations of the braces are that we can only move the teeth where the bones are. If the bones are shorter on the top, we can't just make the bone come out farther. That's why you have to have this surgery. Removing braces. There was a company back in 1991 that made some wonderful braces that were so strong that they would chip teeth when they came off. We don't use those. Nobody does. They stopped making them a long time ago. But that's still theoretically possible. Now, retainers will be all the time for the first year after your braces come off. Now, you're going to be having some replacement teeth made. We will work with you and your dentist, so we'll If the replacement teeth are gonna come real soon after the braces come off, we'll just make you a temporary retainer.
Okay.
If there's gonna be a while, we'll make you a longer term retainer that has some teeth on it.
Okay.
All right. The problem with retainers and teeth is that you can't eat with a retainer in. So if we put teeth on a retainer, you have to take it off when you eat.
Okay.
Yeah. Now, other dental problems like cavities and gum infections can still happen. That's why you have to see the dentist in addition to seeing us. The last part is I don't get to work from home. I have to come here to see you, and you have to come here to see me.
Okay.
So we can't do televisits for braces. That doesn't work.
Okay.
There are orthodontists doing televisits for exams. I'm not sure how they do that exactly. Guess who gets to say this one, sir? Yes. Step right forward. Give me a second to get this. Turn on the little widget. Here we go. Have at. Sign. You're making a promise to take care of your teeth.
I'm not making that promise. I'm signing a piece of paper.
Sorry, you signing it? Do you want me to put blood on there too?
No, I'm not doing
No blood.
that.
Okay. I can actually read your signature
Thank
as
you.
opposed to Mom's.
Okay.
Mom's is a little scratchy.
Yeah.
All right, just like that. Oops, one more click. There. Any questions? Any concerns?
No, I don't have any.
We're waiting. Thank you. Alrighty, that is done. Next, we're going to go to the room over here
Okay.
and start putting those little spacers.
Okay.
Let me go ask if we have time sometime next week to put those braces on. We'll have to wait for a few. I'll put in this paper spacers.
Okay.
What?
I'll just tell her in a few weeks. Not next week, maybe in a few weeks.
Why?
Because you have your thing, your report.
Mm-hmm.
When is your report? 30,
The 30th.
that's a Thursday?
I don't know,
Yeah.
like 30th.
Let me- Probably in a few weeks would be better.
Yeah. What are those colorful things on the wall?
Oh, that's where you hold your.
Uh-huh.
We have to schedule you guys to put on some braces today. Let's go ahead and do that.
Okay.
And then we'll put the little bands on next week. We have plenty of time. We can get them scheduled in next week to do that.
Okay.
Okay, so we're going to start by polishing your teeth.
Uh-huh.
You know, when you go to the dentist and after they're done scraping at them and getting all the hard stuff off, they go through with that sandy gritty stuff and they polish them real shiny.
Mm-hmm.
Yep, I got lots of that gritty stuff
Uh-huh.
right off the beach in La Jolla. There it is. I didn't go too near the seals or the seagulls when they collected it. Do, 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 do. Alrighty, you start polishing these teeth, sir. Open a little bit. Open a little bit. Thank you. Okay, you're making funny faces at me. You don't need to make funny faces. Get off all that icky stuff that's by your gums here. Now I won't be able to put braces on the top teeth today because we need to have Dr. Savelli be able to get at this tooth to take it out. That's the one that's going.
Okay.
And so we'll add those braces next time. I'll just do this one band today for that tooth. All right, go rinse your mouth. Right at the back of the room. Yeah, just take one of the little cups and rinse all that sandy stuff out of there. In case we did last time, we don't have to do that. We will need an upper left.
Yeah, coming.
Don't make a mess.